Breastfeeding is one of the most effective ways to ensure child health and survival. However, contrary to WHO recommendations, fewer than half of infants under the 6-month-old are exclusively breastfed. In this video, we will discuss some of the most important questions that is being asked on breastfeeding. Why breast milk? Breast milk is the ideal food for infants. It is safe, clean, and contains antibodies which help protect against many common childhood illnesses. Breast milk provides all the energy and nutrients that the infant needs for the first months of life, and it continues to provide up to half or more of child's nutritional needs during the second half of the first year, and up to 1/3 during the second year of life. Breastfeeding can also help mother and baby to protect against some short-term and long-term illnesses and diseases. Soon after the birth, how long it should take to start breastfeeding? Breastfeeding should be started as soon as possible after the normal delivery. While in case of cesarean section, it should be started within 1 hour or as soon as the mother gets comfortable. What is exclusive breastfeeding? Exclusive breastfeeding means feeding your baby only breast milk, not any other foods or liquids, including infant formula or water, except for medications or vitamin and minerals supplements. Benefits to baby. Breastfed children perform better on intelligence tests. Breast milk makes a baby stronger, and babies who are breastfed have lower risk of asthma, obesity, type 1 diabetes mellitus, severe lower respiratory disease, acute otitis media, sudden infant death syndrome, gastrointestinal infections, diarrhea, vomiting, necrotizing enterocolitis for preterm infants. Do you know that breast milk is also being used as breast milk massage to baby other than feeding? Yes, also known as breast milk bath, which can be given twice a week. Advantages of breast milk bath is it can reduce neonatal acne and hypopigmented spots. Second, moisturizing effect due to palmitic acid present in it. It is having soothing effect and prevent diaper rash. It prevents cradle cap due to good head nourishment. Prevent wastages. In many cases, there is excessive breast milk production which is discarded if not used, which can be used for breast milk bath or massage to baby. And lastly, it can help in healing minor cuts and wounds due to presence of omega-3 fatty acids. Benefits to mother. First of all, she saves considerable time for herself as she does not have to sterilize bottles or make formula. She also saves money as nothing is spent for buying formula powder. Breastfeeding provides emotional satisfaction and creates a strong bond between the mother and her baby. Above all, breastfeeding improves the mother's health and restores her body after the pregnancy. It helps the uterus to return to normal, reduces the amount of normal vaginal bleeding, and decreases the risk of postpartum hemorrhage. It also helps her to reduce the excess of weight which she gained during the pregnancy. Mothers who are breastfeeding her baby are less likely at risk of breast cancer, ovarian cancer, type 2 diabetes, high blood pressure, etc. Is there any contraindications to start breastfeeding? While human milk provides the most complete form of nutrition for infants, including premature and sick newborns, there are certain rare exceptions where human milk or breast milk is not recommended. If infant is diagnosed with a rare genetic metabolic disorder known as classic galactosemia. Second, mother has HIV, and if she is not on antiretroviral therapy or she is on antiretroviral therapy but has not achieved sustained viral suppression during pregnancy. Mother is infected with human T-cell lymphotropic virus type 1 or type 2 infection. Mother is using an illicit drug such as opioids. Mother has suspected or confirmed Ebola virus disease. These are few contraindications when breast milk is not recommended. How do I know my baby is breastfed adequately? Well, there are certain ways through which you can tell that your baby is getting enough to eat. Having regular wet and dirty diapers are signs your baby is eating enough. In addition, your child's doctor or nurse can check the weight and length of the baby to make sure that baby is growing well. These measurements are usually done at the well baby visits. If you are having questions about your baby's growth, you can talk to doctor or nurse. How long baby can be continued to breastfeeding? Can toddler be breastfed? The World Health Organization recommend exclusive breastfeeding for about first 6 months, with continued breastfeeding along with introducing appropriate complementary foods for up to 2 years of age or longer. Is it safe to take medicines while breastfeeding my child? Although many medications do pass into breast milk, most have no effects on your breast milk supply or on your baby's well-being. Talk to your doctor or nurse if you are having any concerns regarding your medications during breastfeeding. You can visit website link given in the description. If I am breastfeeding, can I give my baby a pacifier? If you are breastfeeding your baby, you may want to wait to use a pacifier until breastfeeding is well established. At that time, using pacifier for naps and at bedtime can help reduce the risk of sudden infant death syndrome. Disadvantages of formula nourishment. Formula milk can cause malnourishment or excessive load on organs if there is too much or too little powder in it. Breast milk contains many anti-infective factors, whereas formula milk can cause diarrhea if the water used for the preparation of formula is contaminated, or if the bottles used to feed the baby is not properly sterilized, then it may lead to infections and diarrhea. Moreover, bacteria may grow on the feeding bottles if it is not stored at appropriate temperature. Can HIV positive mother breastfeed to her baby? Yes, if the mother is on antiretroviral therapy and has achieved sustained viral suppression during the pregnancy. Why can't we give water to a breastfeeding baby before the 6th month even when it is hot and summer season? Giving water to young babies may put them at risk of diarrhea and infection because whatever water we are giving may not be free from infection. Giving water may also cause the baby to drink less breast milk or to stop breastfeeding early and therefore cause malnutrition. If mother give water instead of breastfeeding, it will also cause the mother to have less milk in future. Breast milk is more than 80% water, especially the first milk that comes with each feed. Therefore, whenever the mother feels her baby is thirsty, she can breastfeed the baby. This will satisfy the baby's thirst and continue to protect the baby from infections and helps the baby to continue to grow well. Babies do not need water before they are 6 months old, even in hot climate. Remember this. This is one of the reasons why WHO recommend to exclusively breastfeed your baby for the first 6 months of life. And it should not be given any kind of other formula feeding, water or any else.